Hello, my name is Dr. Francie James. I'm a board-certified urologist and I practice at Urology Associates of Charleston in Charleston, South Carolina. I would like to introduce you to an educational video that will help you understand pelvic organ prolapse. If you are suffering, you are not alone. It is a common condition that affects up to 50% of women, and 1 in 10 women will require surgical correction in their lifetime. Hopefully, you will find some valuable information in this video.
Have you ever had a feeling of heaviness in the pelvic region, vaginal pain, pressure, or bulging? Do you experience heaviness or pressure in your pelvic region? Vaginal pain or pressure, like sitting on a ball, maybe painful sex, difficulty urinating, or having a bowel movement. If so, you may be experiencing something called pelvic organ prolapse, or POP. Living with pelvic organ prolapse can be challenging. It can interfere with your daily activities, intrude on your personal life, and cause some serious discomfort. It is not only physically draining, but it also affects your mental health. Did you know women with POP are 3 times more likely to get depressed? If you're suffering from pelvic organ prolapse, you are not alone. This is a common condition that affects up to 50% of women, and 1 in 10 women will require surgical correction in their lifetime. Pelvic organ prolapse occurs when the group of muscles that support the bladder and bowel become too weak or stretched and cause the pelvic organs to descend into the vaginal wall. A weak or damaged pelvic floor causes organs such as the bladder, intestine, rectum, vagina, and uterus to drop down. That is why women with POP may feel a bulge inside or see a bulge coming out of their vagina. There are several types of pelvic organ prolapse. A cystocele or anterior prolapse occurs when the supporting tissues of the bladder weaken and cause the bladder to descend into the vaginal wall. A rectocele or enterocele, a posterior type prolapse, occur when there is a loss of support to the back wall of the vagina. The rectum or intestines drops down and may cause a bulge in the vaginal opening. A vaginal vault or uterine prolapse occur when there is a loss of support to the uterus and the top part of the vagina after a hysterectomy. Either of these conditions can feel like a bulge, pressure, or heaviness in the vagina. Some causes of pelvic organ prolapse include childbirth, menopause, obesity, and frequent constipation. Remember, POP is a common condition that can be treated. Instead of living with POP, live better without it.
Thank you for taking the time to learn about pelvic organ prolapse. I encourage you to learn more at femalepelvicsolutions.com. On this website, there is a wealth of information on pelvic organ prolapse and another common condition in women, urinary incontinence. On any of the pages, you can click on Find a Specialist to find a physician in your area that specializes in treating these conditions. Thanks again for your time.